it. Sometimes maybe we will say that the implementation might not be very strong, but it has to do with we ourselves as citizens. Because, for example, you know that if you sit here, another person is down here, and then you will allow your children to come your back porch and sit there and defecate. Sometimes you take those pieces and waste it in a dump site. You have in our society here, we do not keep our pets or dogs in a way like advanced country. So our pet go into the dump site, the children go into the dump site, and then when they take these things, they come into contact with these species. When they come back home, hand washing measure is not practiced at the home level, and then they are exposed to these diseases. So behavior change matters. People need to start seeing the fact that they themselves need to take initiatives of their health. For you to have a good public health system, it begins with the population itself, how they can think about transforming. They are thinking about how they take care of their environment and then transform that thinking into practice. Every home should have a trash can. There should be a garbage disposal areas in the community. Community leadership should start coming up with a program wherein they can set up a kind of a waste collection system. That if you take your waste from your house, you don't just waste it anywhere, but you should be able to carry it to a designated area. And it should be collected on a timely basis to avoid it overflowing. When these practices are then actually put into place and everyone try to adhere to it, you notice that our community, our population begin to improve. The number of sicknesses or illness in our society begin to drop. So basically, it's about behavior. People build house, no latrine. They say, especially those along the swampy area, they will go, I will go over the water. But yet still we go into the water, we take what we call the kiss me. We go into the water, we take the tilapia, the one we call the buka, and we eat these things. We take these same pieces and bring it back to us.
These are measures that build any country's economy, because, but we see it as a barrier for us as a country. Moving forward, I know the community or city corporations across Liberia, they have their sanitation departments, but they alone cannot do it all. I pass to some areas and I see baby mothers throwing the pampers all over the place,
Sure.
and no proper disposal, all of that, and but from the end of your unit, what are you preferring? What are you, what are you seeking for in terms of building up on to improve this entire sanitation thing we're talking about here today?
Okay, let me just come in, then my colleagues can follow. Just last year, I think we were able to work through the expanded program on immunization. We went across 9 counties where we were training babies, mothers on proper sanitation. We trained approximately 300 babies, mothers across the country. And the essence of that is we noticed that mothers are the ones who are often at home with their kids. And most often, in terms of most of the household management activities, they take care of it. We thought to tackle them from our end as Ministry of Health or Environmental Unit responsible for sanitation activities, telling them that when you are in the home, instead of you just taking your baby diapers or the pampers and then disposing it all in the environment, it will create more harm. It makes the children very sick because the children play right in the environment. When these feces are spread in the environment, they go into the sand. When they go play in the sand, some of these feces carry germ. Those germ lay in their fingers. Sometimes it gave them worm diseases. So we were training them how they can be able at a household level to put in sanitation measure. And how do they do it? They should be able to identify a way that is suitable for their context. For example, if you have a particular place, maybe they might not be having the fund to buy maybe a waste bin system, but you should find a designated place that you can pile up these pampers, you can pile up these plates and take it to a point that you know that when you dispose of it, animals will not come in contact with it, especially the pets in the domestic animals. The children in the environment will not come in contact. When water flow, it will not just create an erosion and then it dump into a drinking water. So we did this, and we think that targeting the mothers who are in the house often is the best approach that we can use to see how our community can adopt the best system to improve sanitation. Because if sanitation is not improved in our population, I tell you, Melvin, we're going to continuously have an overburdening health system. And when we talk about overburdening health system, like you go to some of the hospitals, JFK, no bed, people come in, the other person, the ER is packed, people vomiting, people coming with stomach running, they charge someone have been running. These are causes that lead to these things. And it's a responsibility of all of us, those who are not doctors, those who are not nurses, though you are not nurse, but you're able to prevent diarrhea. You are not a medical doctor, you're able to prevent malaria. So it's something that we all need to work around it. These are behavior, and this is what we've been doing. And when we go across our different health facilities, even the health facility communities, we educate those people who come to the facility. We educate them on proper sanitation, how to take care of their surroundings. We provide them, and we even show them the impact if you don't do it. These are things that are happening. So we keep educating them. So we are just praying that some of the policies that are in place already, how the government can also put their feet down to make some of these policies very strong. For example, if the Ministry of Health and other MPhil, who are responsible for community health system activities or community sanitation, we can go down harder on them. Some of these people, if a house is not practicing proper sanitation, maybe the government could come up with some measures again. Sometimes we as human beings, we like to see some strong action before behavior change can come.
I think let me just come in. You see, we're talking about gaps. On the rundown of my boss, a series of gaps that we had to face. Like you are talking about solving sanitation problem in the rural area, as you said. People are not aware inadequate system and practice. People are not aware. So the Minister of Health, as she trusted the environmental occupational health unit strongly, we need the means, we need the opportunity, we need the resources, logistics to do more training in our health facility. Even extend to community the importance of sanitation. Because when the people don't have that knowledge, they will not do anything when it comes to sanitation. Sanitation in the rural area almost like a washing thing today. They don't know much about it. When you say wash your hand, when you come from the farm or before you go to the farm, it seems that it's something strange to them. So it should be practiced. More knowledge, more awareness need to be done.
Okay.
Yeah.
So again, to just our price, as in already said, they are our people. Yeah, Liberians, we don't have nowhere to go, we don't have no other country. This is our own. So you said firstly, what are some of the causes that make people and the education stake going on and the awareness going on, but people still practicing poor sanitation? Again, we cannot do what we are not able to do. We will continue to do our best we will continue to carry on awareness. We'll continue to put policies together that will be able to guide our people. We will continue to teach them. We cannot do anything to them, like my boss may say, yes, the government will put things into places, they will put measures, like maybe they find some of them. But again, we will do all those things, but still, one of our paramount point is awareness. I think the government, through the Ministry of Health, will not relent. The teaching aspect will be done. We will teach our people, we will tell them the importance. You see people sitting down here, they got swamp, they just take the cabbages, put it in the swamp. Not knowing that even the fishes that are in a swamp, that those fish will depend on to help us. It can help the children beyond their nutritional status or whatsoever. When those fish are affected, you yourself will be affected. So we will not give up. As environmental arm of the Ministry of Health, we will continue to teach our people, we will continue to tell them the good practices that you will do that will help you to live long, or that will even help the children to come up fine and make them smarter. So we will not give up.
Yeah, Melvin, before we open the phone line, like we see the health workers and government doing all they can on a daily basis to make sure that people adhere to some of these measures, given to them, the education, the different awareness every day. And adherence still remain a major issue, especially when it comes to waste management. We go in the market to see how people behave when it comes to waste. We go in the communities. It still remains a major issue. So I think one thing is we as citizens, all of us need to change our behavior. The education will keep coming, we keep informing them and telling them this is the right thing to do. Adherence become something that people are not practicing. I think people need to pay attention to that. And like the director rightly said, government needs to place a fine in a way that people will be pushed to take the right action. So I think when somebody dispose waste the wrong way, you find the person. When you find them, obviously they know they won't do the same thing, because when they do it, this thing will be coming back to them. So you want to add up?
Yeah, yes.
Go
Quickly,
ahead.
Angel, like with the current challenge that we have, I think we need to take a kind of a more integrated approach, wherein the different actors that has something to do with sanitation, like the Ministry of Health, the city government, you have Waste Commission, Environmental Protection Agency. Then we need to take a kind of a holistic approach or integrated approach towards community when it comes to this sanitation issue. For example, there are many in these different institutions where if you build your house without latrine, there are laws on the board who supposed to regulate that. Those who supposed to regulate that should be able, we combine effort to engage this. Because if the law say that do not build your house without a latrine, and we allow houses to exist without latrine, definitely it's like we are giving rise to what we are avoiding. So we need to take a kind of a joint approach to address this particular issue. If not, we're going to be challenged. And I also think that it's important while we talk about the different challenges, the weaknesses that we have, it's important to also highlight the benefit of improved sanitation.
Mhm.
Improved sanitation leads to reduced illnesses among the population. It also leads to a healthy population and a productive population. If you are sick, if sometimes when stomach running grab you, you're supposed to go to work. But because of the stomach running, diarrhea, make you to be in bed, you are not able to produce. If you are somebody who are very strategically placed in a particular entity, and because of that, you are not able to function. If that entity is supposed to carry on business for that day because of your absence, definitely the productivity of that entity is going to be low. Besides that, it also reduces your health expenditure.
Mhm.
And most importantly, it also reduces what we call antibiotic resistance. When the people take that typhoid medication all of the time, the typhoid you get yourself re-exposed to it. There's a tendency that the medication you are taking with builder resistance, it will make the body will not be able to the infection will not be able to get you from that agent because you have been taking it over and you build resistance. So these are the benefits. If we really practice it, always going to hospital and even our money we spend on hospital on malaria and typhoid, we will not be spending. So it got a lot of benefit. It
Oh.
make us to live long.
So we will join our people out there now, open the phone line so I can participate a little bit before we leave this place. So we're talking sanitation this morning. If you just joined us, you are listening to Roadway to Health, and our long program brought to you by the Ministry of Health. And we are in talks this morning with 3 experts from the Ministry of Health: Mr. Paul Y.S. Honeymoon, Acting Director, Mr. Timothy Keita, National Watch Coordinator, and Mrs. Ubu Soni. So we are talking sanitation this morning. To be a part of this conversation, you can call us on 0880-514-096, 0880-514-096, 0775-677-376, 0775-677-376 are the numbers to call. Call us this morning and be a part of this discussion. 0880-514-096, 0775-677-376.
Yeah. Yes, Inja, before we take your calls, let's just highlight something from the Ministry of Health Facebook page. The Ministry of Health mourns the passing of Dr. Jennifer Amma Harris and Dr. Subaru Atunde Elakron, physicians whose legacy I going to live on forever. They pass on. Of course, we want to say never mind to the bereaved families. And remember, the Ministry of Health has transitioned to the TB reporting from quarterly to monthly nationwide beginning this January. So it's a big news again. And congratulations to the able minister, Dr. Louis Maple Otto, and the rest of her deputies and chief medical officer of the Republic of Liberia. 0880-514-09607. Okay, somebody is on the line. Just please speak with this person.
Good morning.
Good morning.
Good morning,
My
your
name
name?
is T-War. What I want to say, when people take their time, they sit in their houses, get their time to resource, the resource to go and watch out right in the street. So the only thing I want the government to do, let somebody be around. By the time they jump in there, they hold their hand and say, let's go to the election. And you tell the people the next time we see it, we will find you. I'm not going to find that the government get money. They will have enough money. Because people are sitting in the house and get to fast money. So you can't tell me over their business. If somebody they grab it and carry it to the person who sell it without that, you find them, they will not do it again. We will not do it. I'm not paying for sale. We will not do it again. So every time they go through the place, you see the place take it. You go for thank you.
All right, thank you. Good morning.
Good morning.
Good morning, your name and where do you join us from? Go ahead, please.
Yeah, thank you very much for the program. Talking about it, our own health sanitation is very important, very important to our life. But you know, as one of the our duty or the human duty is called of the avenue. Some of us we take our time, something on the road. I was still, remember I went to some part of number 2 and was on the market where I went to a yard as I wanted to use the bathroom. And he said, okay, if you want to use that, he has to put on the bathroom. When I went there, I thought, well, that's all over the city. And the activity is now far away from where their bathroom is. I don't know my parents, but the children have probably all behind the station. And it's not living for them, something else.
Oh, okay.
Thank you. We have a take.
Good morning.
Somebody.
Yeah, go ahead quickly. Go ahead, please.
And you be able to appear on road to this sanitation process. But you have to be more proactive. You know that you have to do community engagement with community leaders to ensure that the issue about imposability become handled. Because if you impose it people in the community handle, whenever come disposing that or that is unlawfully or this swamp, people will be fine. The community get a benefit on our fine. The government to the ministry get a benefit on our fine. It become more effective. Because the order have become you see all around. But
Okay.
all around.
Okay.
You can move our ecosystem.
All right, thank you.
Let's take from this side. Let's hear from this person.
Good morning. Can you walk away from your monitor?
Let's take this person.
Good morning.
Good morning,
Your name and where do you join us from?
James M.K. Kola.
Let's,
Only if I got the compliment.
okay, let's hear you quickly.
Yeah, I think one of the brothers just said something right there concerning about engagement to the community leader. We have been facing similar problems like this in our community. We have tried to see how best to start the circle with a dirt. But people can get given to them at night, at sunlight in the morning, just here all around the streets. So let the Ministry of Health and EPA engage community workshop and call people community leaders and get them tax. But their power is when they give tax to people in the community to be able to start exercising these things because they are backed by government.
Okay.
Thank you. We'll take the last person. No time. Morning. Please go ahead quickly.
We don't have to rush everything about the significant key discussion of Jericho Peters. Well, this is drastic actions. One thing over and over, clean the city, environmental health protection agencies, they are there to see how better the state can be handled through the environmental city corporations and getting along with the city corporations. But these citizens are not willing to take care of the environment.
Sure.
Then another thing will be developed. Because people, one of the things that causes drastic action, water system that is people say that inside people and then incorporate these people. Minimum water is to take these plastics from the market and bring bottles. Because anybody that just drink, I look at how people drink their community.
Okay.
Water, they would dance, all those things.
All right.
Okay.
Thank you, sir.
Okay.
No time, sir.
Thank you.
Angel,
Yeah, so
we are running out of time.
Director Jones, you come in summary to some of the concerns. We don't have much time.
Okay, thank you. I think all of them made a very valid point, especially the issue about doing a kind of robust community engagement is very important in this endeavor. We need to actually do that through the community leadership, and we should use a kind of a holistic approach, an integrated approach. All of the relevant institutions that should be doing anything around sanitation should join to do this particular thing. And I think that is very, very much important for us.
Just give your parting comment.
So basically, I want to say that sanitation is everybody's business. We need to start with it in our very homes, and improve sanitation means having a kind of sanitary facilities that you can properly manage the human waste and all of waste generated by you as a person at the level of the community, so that it doesn't spread and for germs to take opportunity of it and grow, and then it creates sicknesses for us. And the way we can start that, we start cleaning our various bathroom. There's some homes, if you go there and then you ask for the bathroom, that one is not government. Government will not enter your bedroom. Government will not enter your bathroom to clean it for you. You should be able to have that mind that this environment needs to be to that level that I can feel comfortable and feel safe to use it. Thank you.
All right, thank you.
Okay.
Yeah, quickly.
Okay. Thank you, Melvin. Melvin and Angeli, and the public. When you notice that you get tired for, you already finish eating people already. So they get to know that one. And the public, let go Dwala Relay. Please let us clean our environment. Let us clean where we live. If we keep that place clean, we'll not get sick. We'll not go to hospital. Our children will go to school in good health. Our family will enjoy us. We provide money to help everyone. And Liberia will grow. The economy will grow. And everybody will be happy. We will
Okay.
get the sanitation to be a good practice for us.
Thank you.
Thank you.
Madam Sonia.
Okay, thank you, Melvin and Angeline. Angeline, who love to be behind the mark, she have passion so much. And Melvin, who is always sitting behind the mark, smiling. And I thank you. So, to the listening public and to Liberia as a whole, we want you to take sanitation into your hands. This sanitation is everybody's effort. It will take everybody's effort to make Liberia clean and to help us from getting diseases that will kill us soon. So please clean your homes, clean your public places, clean your public toilet, whether pharmacies, hospital, whatsoever ministry. Let's keep our public places, our public bathroom clean and safe for everyone of us. Let's keep Liberia clean so that we can be able to attract others to come to our country.
Thank you.
Okay. So let's keep Liberia clean. Sanitation is everybody's business, but of course, the education will come and right starts with us in the community. We have to start practicing proper sanitation. With that, we stand a better chance to remain healthy. With that, I would like to leave you on to this edition of the program, Roadway to Health. Many thanks to our guests, Mr. Paul Y.S. Kuni, Acting Director, Environmental Occupational Health Unit, Mr. Timothy Keita, National WASH Coordinator, Mrs. Hupu K.S. Soni, Research and Development Coordinator at the Ministry of Health. Thanks to you, our listeners, for playing your listening roles this morning. We have been your host, Angela Noah, and
Melvin Stewart.
A.B. Salif has been here carrying us live. Until next Tuesday, have a good day.
Thank you, Melvin.